Hello, family. Dr. Anton here again. The month of July is National Minority Mental Health Awareness. Stay tuned, you will be informed by minors.
In my opinion, mental health is how you react when you're sad or angry.
In my opinion, mental health is how you deal with the stresses of life.
In my opinion, mental health is how you react when you feel rejected and unwanted.
What are some of the challenges that you face in your everyday life and what do you do to cope?
When I'm at school and I'm at recess, I want to play with one of my friends and I ask them to play with me. They say no and I feel sad. So when I go home, I told my mom that I was sad today and she makes me feel better.
Some of the challenges that I deal with is not being able to answer difficult questions. It makes me feel frustrated, so I ask somebody for help.
When I lose a basketball game, I feel disappointed, but when I come home, I listen to music and relax, and that's how I deal with it.
What will you do if you realize someone is going through a mental breakdown?
I'll cheer them up and I say I believe in you and I hope they feel better soon.
If I ever see somebody who's going through a difficult time or they need help with their mental health, then I'll tell them that they can always talk to somebody that they trust.
I would tell them keep going, I believe in them, and try to encourage them.
Why do you think youth are struggling with mental health problems?
I think youth are struggling because they're trying very hard to fit in.
Youth is struggling with mental health problems because of poverty and racism.
Because they deal with stress and identity crisis.
If someone is going through a mental breakdown, I would advise them to seek professional help to help them find the cause of it.
I would advise people to be nice to everyone because we don't know what they're going through.
Be nice to everyone and encourage each other.
July is National Minority Mental Health Awareness Month. It's a time to raise awareness of the particular difficulties with mental illness that racial and ethnic minorities in the U.S. confront. Less than 1 in 2 African American individuals receive mental health treatment in 2020, compared to non Hispanics, whites, Asian Americans at a 60% lower likelihood to receive mental health treatment in 2018. For many, stigma, limited access to therapy, and lack of health insurance are barriers. What is mental health? Mental health includes emotional, mental, and social well being. Mental health impacts how a person thinks and feels. It also affects how you act, manage stress, and make choices. When you take care of your mental health, you are able to cope with stress or challenges. Sometimes it can be hard to manage your mental health. If you have noticed a change in thoughts, behavior, or mood that disrupt your life, talk to your healthcare provider. You can also contact a mental health specialist or a trusted loved one for help if you have noticed these changes in yourself or in a loved one.
What causes mental illness? Mental illness does not have a singular cause. Various mental disorders may manifest concurrently and unpredictably. They may endure for either a brief or extended duration. Your mental health is subject to fluctuations at any given moment. Several risk factors that may contribute to the onset of mental illness include 1. Consumption of alcohol or narcotics, 2. Experiencing solitude or alienation, 3. Biological determinants or neurochemical. 4. Negative childhood experiences such as child maltreatment or sexual violence. 5. Experiences associated with chronic medical illnesses such as cancer or diabetes. Many identical mental disorders can manifest in both males and females. Nevertheless, women may have more pronounced symptoms.
Family, The goal of July's National Minority Mental Health Awareness Month is to increase public health awareness of the particular mental health issues that members of racial and ethnic minorities confront. These populations frequently face inequalities in mental health care quality and access, which can be very detrimental. This month, July, is a reminder to address treatment barriers in these communities and increase access to mental health care for the minors. Stay tuned. Family, let us now be ambassadors of great, positive, healthy changes. Together, we soar and succeed. The time is now. Bless. Bendiga.